Fine, folks, if you haven't. So I was just going to say this meeting is being recorded. The recording will be put up on our website, which will be provided in the chat. And so you can watch it later, or if you want any materials related to the recording, related to the forum, they'll be available there. I also wanted to let folks know that we will be having a special mental health forum on June 17th, which will be on racism as a traumatic event and on the relationship between racism and mental health. We're still organizing the details on that, but it's likely to be on June 17th at 2 o'clock, and we will be advertising that and putting that on our website. So I wanted folks to know that we are going to be addressing the issues that have come up recently with the murder of George Floyd and mental health related to the police brutality and violence against Black Americans. And that same day on 11 a.m. on June 17th, we will be having another mental health forum that's already been planned, which is focused on domestic violence during COVID-19, and that will be titled Global Perspectives on Intimate Partner Violence and Safety in the Home During the COVID-19 Pandemic. So both of those are on June 17th, and more details to come. So today we're really lucky to have a great set of speakers organized by Dr. Karmel Choi on physical activity and using physical activity to improve your mental health during this time. So I will hand it over to Karmel and our speakers. Thank you so much, Karmel.
Thank you, Karestan, and welcome everyone to our forum focused on staying active to support mental health and well-being during and after COVID. Thank you also, Karestan, for some of those announcements, and these really are important conversations for us to continue in the days to come. So during a time when societal change is so important, and as current realities are so distressing, it is all the more crucial for us to be taking care of our bodies and our minds as we try to make sense of what's going on in the world and think about how to take effective action. So on that note, today we have three world-class experts who will talk with us about some strategies for supporting mental health and well-being through physical movement. They will each give a short talk, and then we will have a time for Q&A at the end. Each of them are leaders in their field, and I'm honored to know them and to have them here today. I am a clinical and research fellow at Harvard and Mass General, and in my own research focused on stress and resilience, we increasingly see that physical activity is a key protective ingredient for mental health. So with that, first I'd like to introduce from the UK, Dr. Brendon Stubbs, who will now pull up his and start sharing his presentation. Brendon is the head of physiotherapy at the South London and Maudsley NHS Foundation Trust and a clinical lecturer at King's College London. So Brendon has been recognized as one of the world's most highly cited researchers and has also published over 500 academic papers around physical activity, mental health, and the mind-body connection. He's also an author of a fantastic book co-authored with Dr. Simon Rosenbaum, who will be presenting next, on exercise-based interventions for mental illness. And Brendon will be sharing with us today about the science linking physical activity and mental health, and also some ideas for what we can do about it. So with that, take it away, Brendon.
Great. Thank you so much, Karmel, for the invitation, and Karestan also for the kind invitation. Really pleased to be here to be able to share with you some of the evidence and the data and the practical implications that seem as pertinent now, or if not more than ever. So really pleased to walk you through some of the science and practical implications. I'm really happy for anyone to ask questions at the end of this, and if people don't have time to ask a question, my email is on one of the end slides, so you can ping me an email if you'd like to as well. So what I would like to do over the course of the three key areas. within the context of the COVID before, during and after, which we're going through, is look at what is the relationship between three different types of physical fitness or physical activity, between how much we move, how good our cardiorespiratory and heart fitness is, and also our muscle strength, and how that may be protective of various mental health symptoms and conditions. And then look at some of the evidence about how these different types of activities targeting these different fitness systems may contribute to mental health symptomology and also improve physical health. And obviously, I don't need to go and explain about some of the restrictions that are in place around people not being able to move around as much. But this evidence is pertinent now more so than ever, and going to present it within that particular context. Obviously, I'm quite enthusiastic about the area. I've written some guidelines on the topic. I've written a commission which broadly touched on this topic, a book with Simon. So please view these slides with rose-tinted glasses and everything I present, because I think it's fair to say I'm quite biased in terms of my allegiance to the field. But everything that I've got to sort of say really is in many ways not particularly new. People have been saying for a very long period of time that lack of movement, not being able to move around in our daily life, is really important to us to be able to manage and promote our mental health and well-being over the life course. But it's only relatively recently that the science and the epidemiological data has really started to capture or catch up with some of our predecessors who had these hypotheses many centuries ago. And just wanted to highlight a couple of good meta-analyses of observational studies that I've been fortunate to be part of recently. And one was by Felipe Schuch, a professor in Brazil, who looked at a really simple question to understand: is there a relationship between how active we are in our daily lives and our risk or odds of developing depression in the future? And Felipe pulled data from over 260,000 people across all geographical regions and found that over an average of 7.5 years, that people who were more active in their daily lives were less likely to develop depressive symptoms or depression in the future. And this was evident in young people, working age or older age people as well. And when we try to adjust as best as you can for various confounders. Now, this is great observational data where we're observing the relationship over time, but it's not enough in its own to say there is a conclusive relationship. So there's been some really nice work which Karmel and others have led, which have really tried to help advance the sort of epidemiology work to say that there is, really does appear to be a causal pathway between objective accelerometry-derived physical activity and the risk of depression, looking at specific SNPs. So it's not just the prospective data showing more active you are in your daily life can protect you against the risk of depression in the future. We've got genetic data, and there are some randomized controlled trials, which I believe Simon's going to talk about as well, what happens when you stop physical activity in a controlled manner, and you look at changes in people's mental health symptoms, but Simon will talk about that. Just also to say, we've looked at this issue in anxiety as well, and now is a very anxious time for us all for lots of different reasons. But Felipe did this paper and found a very similar thing, that if the more people are active in their daily lives, and physical activity we're defining as any bodily movement that increases energy expenditure, are less likely in the future to develop anxiety symptoms or an anxiety disorder. And there's some tentative evidence that it may help reduce your risk or odds of developing specific anxiety and stress-related disorders such as agoraphobia and post-traumatic stress disorder. So one of the key limitations of the data so far is that most of it has relied on self-report physical activity data, particularly longitudinally. And Aaron Condola is a fantastic PhD candidate from UCL and did this really nice paper in over 4,000 adolescents with multiple time points to say what happens when you look at objective physical activity in different intensities and sedentary behaviour in adolescents across 12 to 18 years. And Aaron demonstrated in a really nice way in the blue line there that young people who are consistently sedentary are much more likely to develop depression in the future, But interestingly, just changing around an hour a day of light activity with sedentary behaviour, you can get a reduced risk of depression by around 8 to 11%. And most of the evidence base so far has focused on the intensity of moderate and vigorous physical activity. But what this is indicating in adolescents and also in older adults as well, I'm not presenting that data, is that light intensity activity can have a really important protective effect, but is often neglected in physical activity guidelines. Now, cardiorespiratory fitness is how well your heart and lungs respond to exercise, and it's a good objective marker of fitness. And Aaron's done this, and Felipe Shook's done some earlier work, showing that if we engage in activity that gets the heart and lungs working well, then we're less likely to develop common mental health conditions as well. So the key implications for this in the current time is that movement around in our daily activity, whether that be light activities or more vigorous activities such as running, can help protect longitudinally from the emergence of common mental health symptoms and disorders. But the other area of fitness which I'd like to briefly touch upon is the relationship between muscular strength and future mental health symptomology as well. Joe has a paper under review which we're revising at the moment, looking at the relationship in the UK Biobank between grip strength and future depressive symptoms in the general population and also people with major depressive disorder. And it's indicating that people who have good muscular strength are less likely to have depressive symptoms at various time points in the future, generally, and also those with clinical depression. So movement in our daily lives, such as walking around, moving around, is really important to protect against the emergence of mental health comorbidity. Exercise where we get our heart and lungs racing is really good, but so is physical activity and exercise that works on our muscle strength to improve our mental health and protect us in the future. I'm briefly going to touch upon the interventions now. So Felipe Shook again did a really nice meta-analysis looking at how good is the evidence base when you compare exercise as an add-on treatment versus usual care, and found that exercise over a 12 to 16 week period can have large and significant improvement in reducing depressive symptoms. And one of the fair criticisms of exercise as an actual intervention for depressive symptoms is the studies have been relatively small, often less than 100 in each arm, often short in terms of follow-up. Mats Holmgren in the Karolinska Institute did a 3-armed randomized controlled trial for people with depressive symptoms in the community. One received exercise, one received CBT delivered via the internet, and the other group received treatment as usual. All three had over 300 in each arm and were followed up for 12 months. And Matt's found that exercise and CBT were equally as effective as each other, but both clinically and significantly better than treatment as usual. Now, you'll find much more research and much more smooth patterns of people getting talking therapy, but it goes to show the potential power of exercise as an approach. Most of the evidence has been an aerobic exercise, but just also to highlight that resistance training, where we try and really work the muscles and the musculoskeletal system, can also be a really important strategy to reduce depressive symptoms as well. And I recommend this nice meta-analysis published in JAMA Psychiatry recently. So where are we in relation to guidelines? Myself and several other colleagues looked at all of the available evidence for people with different mental health care conditions and said, what is the evidence base of physical activity in the prevention and management of different mental health care conditions? And essentially we found this good evidence to say that physical activity should be used as a strategy for a frontline treatment for depression to improve mental health symptoms, quality of life, cardiorespiratory fitness, and physical health outcomes. And there's also good evidence in schizophrenia for numerous outcomes as well. Getting onto the take-home messages, particularly in light of the current situation. So the final slide. So hopefully you've been able to demonstrate, I don't need to emphasize the restrictions and the changes and the anxiety that's happened as a result of everything that's going on, but hopefully you've been able to demonstrate as a result of this evidence that generally the more active we are in our daily lives, the more we can protect ourselves in the long term and also in the short term from depressive and anxiety symptoms. being consistently sedentary or all of a sudden having onset increased sedentary behaviour is associated with an increased risk of mental health symptoms. Cardiorespiratory fitness, getting our heart and lungs working hard, and also muscle strength are also good targets to maintain mental health and well-being, and also to improve symptoms of people who may have mental health symptoms. But the key message for me in this crisis, personally and generally, is find a movement that you enjoy, whether that be light running, yoga, strength work, and keep doing it, because we're much more likely with any particular behaviour to start it and continue to engage in it if we're finding that we're enjoying a particular movement. So any movement is good. The key thing is getting started. I think I'll leave it there.
Great, thank you so much, Brendon. Really helpful information highlighting the strong links between physical activity, mental health, and also highlighting some suggestions for us all, including the importance of any movement. To build on that, I'd now like to introduce Dr. Simon Rosenbaum, who is joining us from Sydney, Australia, where it is currently 1 a.m. in the morning. So thank you so much, Simon, for being here. Simon is the National Director of Exercise and Sports Science Australia, and he is an Associate Professor and Scientia Fellow at UNSW Sydney. He's also an Honorary Fellow at the Black Dog Institute for Mental Health. And as an exercise physiologist, his research lies at the intersection of physical activity, sustainable development, and global mental health. And in recent years, he has been working in Bangladesh to develop sports programs to improve psychosocial well-being among refugees. So today he'll be sharing with us about some strategies for boosting physical activity no matter where you are. So with that, take it away, Simon.
Thanks, Karmel, and thanks for the opportunity, the invitation to present today. I will just apologise in advance. It is about 1:15 in the morning here in Sydney, Australia. Look, I'd just like to start, as is tradition here in Australia, by acknowledging the traditional custodians of the land. I'm here in eastern Sydney in Gadigal country, and I think I'd just like to mention that, in light of the events that are happening around the world at the moment, it's no different here in Australia, and since 1991 we've actually had 432 Indigenous deaths in custody. So it's a huge issue, and I think as health practitioners and public health professionals, we all have a role in addressing injustice and inequality. And I know we could probably talk about that all night, so I'll jump into the topic of today around physical activity. What I want to touch on here is this great slide that Brendon alluded to and mentioned. This was a trial that looked at the effects of inducing sedentary behaviour. So what happens, what are the mental health impacts of when we take healthy people who are normally active and make them inactive for 1 week? And what happened over that time period was that inducing that sedentary behaviour actually increased levels of depression. And that's that orange line you can see. And the blue line was a control group, and the control group actually ended up doing more exercise despite being told to do whatever they normally do. And what happened was their levels of depression decreased slightly over that 1 week period. So this is really important experimental evidence showing that inducing sedentary behaviour has a detrimental impact on their mental health. And it's particularly relevant at the moment with COVID and with the lockdowns and with people not having access to the usual physical activity that they engage in. One of the other key things I wanted to mention was the impact on health workers, and we're here in Australia and other places we're being warned of this tsunami of mental illness that's likely to occur in response to COVID. But this study here, this is some longitudinal data that tracked people over 20 years, showing that the age-related decline in physical activity is related to PTSD symptoms. So in other words, the more PTSD symptoms someone experiences, the steeper their drop-off in physical activity. And I think this really raises the question around prevention. We're going to have a lot of health workers and a lot of people that have been on the front line, a lot of people just dealing with isolation and trauma. Their activity levels are going to decline, their physical fitness is going to decline. And is there a role for prevention here if we're able to intervene early and keep these people active? And I think this data would imply that possibly the answer is yes. And along with the work that Brendon has shared around the role of exercise in potentially preventing exercise and preventing depression and anxiety. So I think there is an important factor there for PTSD to consider as well. Now, one of the things that I just want to touch on is the different domains of physical activity. And we know that when it comes to the mental health benefits, it's actually not all the same. So there are 4 different domains of physical activity. There's leisure time physical activity, occupational physical activity, transport, and household. And we know that when it comes to the mental health benefits, it's actually different depending on the domain. So somewhat unsurprisingly, leisure time physical activity is actually the most important when it comes to the mental health benefits. And again, unsurprisingly, we don't quite get the same mental health benefits from high levels of occupational related physical activity, which are actually associated with mental ill health. So this is a really important point when we talk about physical activity promotion and the idea of finding strategies from a public health perspective about how we can actually get people access and help people to engage in leisure time physical activity. Now, there's a paper led by a colleague here in Australia, Megan Teixeira, that we published this year, arguing about, do we need new physical activity guidelines? And we hear that the guidelines for exercise are around 150 minutes a week, but they have been based on typically the cardiovascular outcomes associated with physical activity, as opposed to the mental health benefits. And as Brendon alluded to, the mental health benefits of activity come from any amount of activity. It's not just that 150 minutes. And so, the idea about the activity guidelines changing to incorporate mental health, I think, is really important. And the answer to this question is probably, we don't need specific guidelines, but we absolutely need physical activity guidelines that are mental health informed and that consider the domain of physical activity and the opportunities that people have to actually engage and participate in exercise. Now, Brendon mentioned this before, but I think we'll just keep reiterating it, that one of the most critical factors associated with long-term adherence, long-term engagement in physical activity is enjoyment. And there's no point as health professionals telling people go and exercise to avoid diabetes or go and exercise to avoid depression. We know that actually doesn't change behaviour. We need people to be autonomously motivated and decide that they want to exercise because they see the benefits and they value that. And enjoyment is absolutely one of the most important things that we can try and foster and facilitate among the people that we're working with. One of the things I just want to highlight here is around the idea that leisure time physical activity, despite being so important, really is a class privilege. So the lowest income earners are up to 55% less likely to meet leisure time physical activity recommendations. And I think this has really important implications when we're talking about how do we motivate those and how do we help those that are in that bracket to actually have access to appropriate interventions. And a couple of things I'll point out. So one, this is a brief editorial that Brendon, Joe and I wrote together, highlighting some of the evidence around the intervention strategies that work, and particularly that includes having access to practitioners who can provide that one-on-one support. And we know that's associated with long-term adherence to activity programs and finding something that's individualized for that individual. This was a great paper that was covered in the New York Times this year, showing that this idea of exercise snacking, which was as little as 20-second bouts of activity, can have an impact on cardiorespiratory fitness. And given that we know fitness is related to mental health, as Brendon has showed, it's likely that sort of approach would actually impact our mental health as well. And again, on that idea of enjoyment, which is so important, finding the right type of activity for the right person. This is some coverage of a review we had out again with Joe and Brendon a couple of weeks ago, looking at the role of yoga. And so again, if that's a type of activity that someone enjoys and they're likely to stick with, then by all means, we should be encouraging that. This is my final slide, just some of the work from Bangladesh that we've been doing with the Rohingya community. And this is an animation we put together called Exercise for Everyone, or Exercise is for Everyone. And it's really trying to challenge that notion that exercise is actually a privilege associated with class and and access, and really that everyone, no matter where they are and who they are, can have access to, or should have access to, exercise that's appropriate for their body and something that they enjoy in order to improve mental health. And I'll leave it there. Thanks a lot, Karmel.
Thank you so much, Simon. Really brilliant points raised, and also, again, helpful suggestions around really focusing on the types of activity that we can do that are manageable and enjoyable even under the current restrictions. And hopefully we can have some more questions and discussions around practical ways to do that during the Q&A. So finally, I would like to introduce Dr. Joseph Firth, who is a Presidential Fellow at the University of Manchester and also a Senior Research Fellow at Western Sydney University. Joe recently led a Lancet Psychiatry Commission focused on physical health and mental illness, which was published as a landmark report last year. And his work focuses on exercise, nutrition, and using novel digital technologies to promote mental health in young people. And he will be talking with us a bit about the links between physical activity and brain health, including thinking and cognition during this time. So with that, take it away, Joe.
Can you see my screen okay, Karmel?
Mm-hmm. Yes, thank you.
Okay, great. Okay, thanks everybody. Yes, I'm Joe Firth from the University of Manchester. I'll apologise in advance for my outrageous Yorkshire accent. If you can't understand a word of what I'm saying, feel free to drop me an email after this. But yeah, those guys have already spoke quite a lot about the benefits of exercise for mental health, which is actually my main field as well. But I'm going to speak quite quickly now and briefly on the benefits of exercise for brain health. And obviously, it's a very old idea, as Brendon touched on in his talk, the idea of the connection between the healthy body and the healthy mind. And here's a good quote from the ancient Buddha showing how long these ideas go back of the connection between cognitive health and physical activity. But it's also something, you know, which has been going through modern society for a long time. And here's a good quote from John F. Kennedy, a very smart president, of course, who was also quite into his own health and fitness, talking about how fitness is obviously key to a healthy body, but also the basis of strong intellect. Albert Einstein did not really say much on the matter himself, but as you can see from this photograph, he was also a big believer in this concept. And there's more and more around, you know, the growing interest in exercise and mental health, and within this, the exercise and brain health. Now, what about the evidence? Where is the evidence for the actual connection? And the best and most recent up-to-date evidence actually comes from America and your Department of Health and Human Services, which produced a systematic review of reviews around the connection between physical activity and brain health across all different populations. And they brought together the findings from 71 independent systematic reviews around physical activity and brain health, and found strong evidence across the board, really, from randomized controlled trials and observational studies, showing that exercise increases a broad range of different cognitive functions right across the lifespan. And this includes young people and old people. So just speaking to the topic of today's subject, really, you know, we are all being forced into a physically inactive time in some respects. You know, that we can do what we can to try and stay healthy and fit, but it's important to also consider, you know, the impact that could be having on people's cognitive performance and brain functioning, given these strong links between the physical activity of the population and also our ability to function cognitively. I'll talk a little bit about the actual effects on the brain, and not only how well our brain is working, but how it's actually, you know, building and how it's actually persisting on in physically in our, you know, in our schools. So this is a meta-analysis that we performed with Simon and Brendon, actually, who you just heard from last year, looking at the effects of aerobic exercise on hippocampal volume. The hippocampus is a specific part of the brain which is quite sensitive to various different environmental exposures, but in particular physical activity. And we wanted to look at the overall effects. And what we found across a number of different randomized controlled trials and 737 people who have been scanned before and after exercise interventions, that aerobic exercise, as you can see, compared to control conditions in clinical trials, significantly increases the volume of the hippocampus compared to control conditions. But when we looked a little bit closer at the data, and now this is not an actual graph of the data, this is more of just an illustration of the trends that were emerging from the data. But say if you've got the exercise group and the control conditions, it was exercise actually seemed to be more decreasing the hippocampal, preventing the decrease that we see in hippocampal volume that occurs over time in aging populations, such that the the blue group is the one who gets exercise, and the orange is the control conditions. And when they start receiving exercise, what you see is a general decrease in hippocampal volume that occurs with aging becomes attenuated. So the significant difference in the brains of people who exercise and those who do not exercise actually seems to occur from preventing decline rather than stimulating brain growth in that region, which is quite interesting really in terms of the current situation, because it indicates that sedentary behavior is something that might actually propensitate the decline in brain volume. And if we induce sedentary behavior to animals under lab conditions, we actually see decreases in brain volume in those type of studies. So it's quite interesting to think about how, any sort of population scale inducement of physical inactivity could actually be taking its effect on brain volume if people aren't able to exercise, particularly obviously in aging populations where we generally see decreases in hippocampal volume after the age of, say, 50. But how does this happen? Well, there's a broad range of mechanisms which have been shown in clinical and preclinical studies of how exercise actually affects our brain. And this is important not just for understanding the science, but also for understanding how to avoid or the adverse effects or maximize the beneficial effects of exercise on the brain. And it's supposed to be linked to inflammation, to BDNF, which is a prime neurotrophic factor, but then also, of course, our actual physical health. If we see people with diabetes and other chronic metabolic conditions, we actually see them at greater risk of neurocognitive conditions and cognitive decline. So by protecting our physical health, exercise is also protecting our brain health. But there's a number of different mechanisms, and this is the best summary of it really, from quite an old paper, Kottman in 2007. But I'd suggest taking a look at that if you're more interested in the ways in which exercise influences the brain. Now, we spoke a lot about aerobic exercise. Obviously, strength training is becoming more popular over time. Can that affect the brain? And the evidence here is growing, but it is currently more nascent. We've looked at data from the UK Biobank, which is a study of over 500,000 people across the UK, to examine how people's physical strength is related to their cognitive performance. And what we found from looking at this population scale study is quite strong relations. As you can see, the graphs here show the relationships between people's strength as it goes up towards the left, and people's measured by grip strength, of course, which is obviously squeezing a dynamometer to measure just an approximation of your maximal muscular force output. And we looked at this in people with schizophrenia, but also the general population, and we saw very strong correlations between grip strength and people's ability to function cognitively across all different domains of cognitive functioning examined. So that indicates, by perhaps improving and protecting our muscular fitness, not just our aerobic fitness, we might also see benefits for the brain. Which we've seen also similar types of effects in depression. We published this research in JAMA Psychiatry last year, showing similar effects at people with mental illness also. Mental illness is obviously associated with, even if it's just depression or bipolar disorder, cognitive impairments of varying degrees. But the people with mental illness with greater levels of muscular strength actually have greater levels of cognitive functioning, which suggests this could be quite a promising intervention to attenuate the cognitive deficits that we see in people with mental illness. Strength training, that is. So I won't talk too long, but yeah, basically the overall idea, what is emerging from the research is obviously aerobic fitness has got really strong evidence for increasing our cognitive functioning and protecting our brain health, just staying active overall. Strength training is emerging as a way that might be complementary or additional, or even perhaps you can do it instead of aerobic fitness to protect and improve your brain health. I would say when I got into this field, I was of the opinion, that sedentary behavior is the root of all evil, and it's by just replacing this with physical activity, we can sort of solve every problem. But obviously, that's not the reality of the situation. That's not a good model for thinking about the relationships between exercise and brain health. It's more like, people who are actually experiencing mental health problems or suffering from cognitive decline are at much greater risk of becoming sedentary or engaging in other adverse health behaviors, which has a detrimental effect on your physical health, and in turn on your mental health. And then the physical health itself kind of keeps that circular relationship going, impacting directly on your cognitive health and psychological functioning. And by switching out those adverse health behaviors for physical exercise, be it resistance or aerobic training, we obviously straight away improve people's physical health, which has a direct effect on their mental health. And perhaps these activities themselves also include improved cognitive functioning and psychological well-being. It's not going to solve every problem, obviously, but it's going to actually improve the overall profile and improve people's chances of recovery and having greater brain function than if they didn't engage in these activities. So it's about supporting people to do those through public health or through clinical intervention schemes. So I'll stop there. Thanks a lot. I'll put myself on mute now and stop the video. If you have any questions or can't understand my accent, feel free to drop me an email.
Thank you, Joe. Really helpful framework for thinking about the links between mental and physical health. I'd just like to thank all of our speakers again for sharing their expertise and really highlighting the importance of physical activity and being active for keeping our minds and bodies well during challenging times. So let's turn now to a time of Q&A. I'm seeing that there are some questions coming in from our attendees. If you do have any questions for our speakers, please add them to the Q&A box and we'll try to address as many as we can. So we had a question come in from Dr. Lucy Loveday, and it was a question about how we can communicate examples of light physical activity to adolescents for young people, especially during this time of lockdown and change. So Dr. Loveday was asking, can you provide us with a few simple sentences we can use in consultations with this age group, and any examples of physical activity you would advise as examples? Any thoughts there from Brendon, Joe? And
so I'm happy to. I think I presented that data. So speaking from personal experience and professional experience as well, I just encourage young children to go and play. And playing around and moving, whatever that may be, kicking a football around or any other sort of type of activity, just to go and have fun. Just any movement is very good for people's physical and mental health. So I just encourage young children just to go and play and climb trees, strength training, run around, kick a football around if that's what you want to do skipping. All of this is great types of activities that are fun. So just encourage young people to find something which is enjoyable and start doing it.
I'll just jump in there. I think,
Sure.
I mean, I totally agree with what Brendon's saying. I guess one of the things that I just add is about when we talk about the messaging around physical activity, whether we're trying to sell it to avoid a negative or to gain a positive, and that's a really important distinction. So, for example, one of the issues that it's not quite relevant to young people, but if we're talking about just using exercise for weight loss, for example, that negative messaging, so telling someone to do it to avoid punishment or to avoid something negative is not as effective as talking about what they can gain from participating in exercise, talking about the positives. Telling a young person that they're going to avoid diabetes or cardiovascular disease, for example, is not going to change behaviour. So we need to find the sort of carrot versus the stick, and what's the positive that young person stands to benefit. And again, it comes back to finding the type of activity that they enjoy and they want to do.
Mm-hmm. And I have a follow-up question for you all related to that, which is, what are some of the specific ways that the coronavirus pandemic has interrupted our ability to pursue some of these enjoyable activities, or going out, kicking a ball, playing, and to engage in this type of physical activity? And how might that sort of look different here?
I'm happy to make a start, and I'm sure Joe and Simon can add more. I think one of the key things around physical activity and exercise literature about why do people engage in it, not everyone, but some, a big proportion, is feeling a sense of social support and being part of a group and feeling a sense of belonging, whether that be, in young people playing with somebody else, or being part of a sports team, or feeling a sense of social connectedness. So obviously with the current restrictions, and I'm not aware of what they are in various places around the world, but certainly within the UK up until recently, is you could only go and exercise with people within your household. So that really does alter the sort of the dynamic through which, if you were young, you may go and play with your friends, you'd have to go and play with your parent, for instance, or you could only go out with people within your household. So it's brought in sort of new and different challenges, which has made people sort of really have to think outside of the box. So I think that lack of the social aspect of physical activity, play, fun, movement, has been a real key challenge, because we know from the evidence base that can be really important for people, particularly when people have raised mental health symptoms or a mental health diagnosis as well.
Mhm.
Yeah, and I'd say on top of that, after Brendon's obviously hit the nail on the head there with the first most important thing for motivating you towards physical activity is usually the social aspect, doing something enjoyable. But then second to that, I'd say the other motivating factor is that sense of progress that you can get from engaging in physical activity, be it through sports or gym training or things like this. Like, people like to feel like they're getting better, and at the moment, with like most facilities shut down or coaching's not happening and things like that, we're seeing like a real knock-on effect of everybody is kind of in maintenance mode with physical activity. Even the people who are the most motivated are just doing things kind of waiting for all this to be over. But I think that really hinders people's motivation and kind of takes the fun and rewarding aspect out of a lot of different sports and physical pursuits as well. So obviously it'll be nice when all this is over, but yeah, for the time being, that's the cards we're dealt.
Mm-hmm. Thank you, guys. And related to that, we have a question from Irv Plotkin about a reference to physical activity in housework and household physical activity, and that's obviously something that's kind of more relevant nowadays. So could you all elaborate a little bit on that and any benefits that people get from that?
Yeah, I mean, I'll jump in there. I guess that was one of the slides that I put on. It's a bit tricky because it's sort of conflicting messaging. Because at one hand, we're saying any activity is better than none, and that's true from a mental health perspective. But we also know that when we look at it a bit more in more detail in terms of those different domains, we know that leisure time physical activity is ideal, and that's probably because it comes with agency and choice, and there's other factors around it that are implied if someone has the luxury and the privilege of engaging in leisure time activity. So, you know, in short, the idea about moving our bodies more is going to be good, and if household chores is a way that someone can do that and they're happy to participate in that, and that's great. It's just going to build capacity, it's going to be a platform. But we sort of need to also have the idea that, you know, anything is better than nothing, but we need to try and do a little bit more as well. Exercise is just a stress on the body, and the body adapts, and then we need to increase the stress, and whether that's the duration, so the minutes or the volume or the intensity, we need to constantly, as Joe said, look for progress and try to increase that and make that a little bit tougher.
That's a great point. On building on that, we have, go on, Dr.
I was just going to add a little bit. I should caveat this, that I'm a little bit shy on housework and doing indoor physical activity myself. But we don't actually know a lot of the details of different intensities, because when we often ask people about the context of their physical activity, whether it be in their leisure time, household or outdoors, we're relying on this great amount of evidence-based and self-report measures, often over long periods of time and many years ago. So we don't understand a great deal about this in terms of how good these interactions are, but some of the observational data which we've done so far just reinforces the point which Simon said, really, that, you know, getting outdoors, particularly for some people who can, is really beneficial. Leisure time physical activity is good, but on an individual level, as I know numerous people that I work with on a clinical basis find that indoor physical activity is really good and beneficial for them as well. But I think there's much more to do to try and disentangle the different contexts around physical activity. I will add just a very brief point as well around sedentary behaviour, and it is caveated with the reliance on self-report data, is there's emerging evidence to say that not all sedentary behaviour is equally as bad for your mental health. So there's this emerging concept around passive sedentary behaviour, such as me staring at Netflix and not really engaging cognitively, or just watching TV and not engaging, or active sedentary behaviours such as me talking in this conversation now, the cognitive networks which are going on is very, very different. And there's emerging evidence. We've done some data with Mass Organ in Sweden, other databases showing that actively engaged sedentary behaviour can be not associated with worse mental health in the future, but it's the passive sedentary behaviour which appears to be associated with worse sort of mental health in the future, but that is caveated with the reliance on self-report measures also.
Mm-hmm. That's a great distinction there. We have a lot of really interesting questions coming in. One of them is, are there any differences between effects of exercises that are sort of more tied to a mindfulness tradition, like yoga, versus things that are more aerobic or otherwise, in terms of mental health impacts?
Who wants to jump in?
You go, Simon.
I think you should take that one, Simon, on the basis of the recent meta-analysis.
Well,
yeah,
we will.
British Journal.
We were all involved with that. So the review recently that we published in the British Journal of Sports Medicine looking at yoga. Importantly, we looked at movement-based yoga as opposed to other types of yoga like laughing and chanting-based yoga. We weren't able to pick apart the contribution of the sort of mindfulness components versus the yoga itself. That was really difficult. It's likely that there's an additive effect. But again, I think it's really difficult to answer the question about what type of exercise is better than the other, because really no one type of exercise is better than the other. The best exercise program is the one that you as an individual will do. And the one that addresses the unique individual barriers that each person has. So if we're talking about other contexts, for example, where there may not be safe footpaths, or we're talking about cultural clothing where people can't actually exercise, or we're talking about the safety and the environment for people to walk around, there's all sorts of factors that contribute. So we can't, there's no point saying that this one type of exercise is the best type of exercise, and comparing them head to head probably isn't that useful either. It comes down to patient or the person's preference and their level of enjoyment.
Sure. And that's perfect point. I think with, Simon covered that point really well. And I would say that, unfortunately, to date, most of the evidence based around randomized controlled trials that have looked at yoga or Pilates or other type exercise interventions, which are slightly less conventional than aerobic or resistance training, haven't been as generally as good quality. So the evidence base is not quite as strong in terms of academic rigor, although it is improving all of the time. So it would be interesting to do some larger based randomized controlled trials to look at that. But I think really the point gets back to what Simon said, is what is going to be the most beneficial and engaging for you, which you're going to sort of stick at and enjoy over the long term.
And a related question came in about what are some ways we can address the issue that some types of leisure time physical activity is more of a class issue? That's a really excellent question.
That's a really difficult question. And the reason why nobody's answering is because that, it speaks to social inequalities. How can we solve those and things like this, which is, it's a real challenge. And I've actually recently been sitting on the WHO panel for the next physical activity guidelines that we're developing, the World Health Organizations. And it's something we're really struggling to make recommendations around as well. And it links back with the earlier question around the difference between, say, household chores, or what about people who are very active at work? Is that good for you? Or if you're running yourself into the ground with physical activity due to the nature of your profession and you're constantly exhausted and kind of injured and feeling ground down by it, that's obviously not good for your physical health. It's obviously not good for your mental health. And kind of closing that and then telling those people they have to do leisure time physical activity as well doesn't really make sense. So it is a really, compounded issue, conflicted issue around how can you fix this thing around people. Some people have access to beautiful gymnasiums and all the time in the world to do that and experience those mental health benefits, and then other people, don't have those opportunities. But there is, some really good people out there, like say Simon Rosenbaum, who's been setting up sports groups for refugees in Bangladesh and things like this. So there's always ways to find enjoyable physical activities, even in the harshest environments. I'll let him talk a little bit about that if he wants. I'm sure he does.
Thanks, Joe. I think that the only thing I'd add there is that if we really then, and I think Michael Marmot's work in this area around social determinants and the social gradient of health is so important and so relevant. But if we really, truly actually, see exercise and value exercise for what the evidence tells us, then we would actually treat it like, a proper public health intervention and resource it appropriately. And that would mean ensuring that facilities are, are subsidised and people have the ability to, with means, or whether there's health professionals that are utilised to actually support that. And at the moment, I think too often we sort of see exercise as being this thing that, well, you should just be able to do it for yourself, and it's taken people, often their entire life to form the habits and patterns that they do. And it's not going to be as simple as, a general public health messaging campaign saying, try and do some more activity in order for it to be effective.
Great, really important points. We've had a couple of questions come in around the theme of motivation for physical activity, especially in the context of people feeling low, feeling depressed. So any thoughts about engaging in physical activity for those who are kind of starting from a more low place, and any tools that might be helpful for really boosting that motivation?
I'm happy to start and share a little bit of some clinical anecdotes. I work with predominantly people within inpatient setting, and many people are obviously very depressed, very low, and difficulty getting out of bed, as you can imagine. So some of the things that have worked for me to help people over the time is just goal setting real small, realistic, achievable goals, whether that be just getting out of the bed, sitting out in the chair at the start of the day, going for a couple of minute walk, going up to the edge of the door, just really small, realistic goals in the first instance for people who are severely unwell in hospital. And again, kind of like a similar approach for people who are maybe not so well but have low mood or depressive symptoms or clinical depression in the community. Early on, goal setting and people feeling a sense of achievement, success early on is really, really important to get people engaged in an activity, and also moving along the activity continuum in terms of increasing the amount in which people are doing and increasing the intensity in which they want different things. For me, when it hasn't gone so well, when I've been working with people, is when the bar's been set too high or somebody hasn't had success early on, and that's really sort of backfired. So making it accessible, easy to achieve early on has been really important for me in sort of my own clinical practice and helping people. I don't know if Simon and Joe, you want to add some science to what I just said?
Go for it, Joe.
You go, Simon.
The only things I'd add there is
Add some science.
The only thing I'd add is identifying the barriers. So really, try and, is it shoes, is it clothing, is it facilities, whatever it is, find a buddy. We know that social support is hugely important. And the final thing is I try to encourage people that I'm working with to actually keep track of their activity and keep track of their mood. And what we'll see is that actually, people then, that can be useful, like a little mood diary, a little exercise diary, ask someone, how do you feel 1 to 10? Keep track of that, and often we'll see patterns in people's activity and patterns in their mood where they'll say, oh look, I noticed that the day after I've done these big walks or I've managed my 10,000 steps or whatever it is, I feel a bit better, I slept a bit better. And then having that psychoeducation and getting people to actually make that link and make that connection and then feel it for themselves is when we'll shift that motivation to be more autonomously motivated, when we're likely to get that long-term change.
For older populations who are more prone to risk of falls and other limitations, what are some ways to encourage them to engage in physical activity, and what kinds of activities?
I think a good way to start with...
Sorry, do you want to go, Joe?
Brendon. No, clearly you seem very keen. You go ahead.
So the question was how to engage older people who may be at risk of falls and other things to engage in physical activity. I've personally found dancing and encouraging people to dance is a particularly useful strategy. And there is some good evidence around dancing for people particularly to music, to get people moving as well. So that's been a really beneficial activity that I've often used in sort of clinical practice as well. And it just gets down to getting people to find something which they enjoy, getting people up on their feet, feeling confident if they are at risk of falls, getting moving, getting the lower limbs working in terms of muscle strength, balance and function, and helping people feel steadier on their feet. And there is a really close relationship between low mood, fear of falling and natural falls in the future. So helping people feel steady and safe early on is key. Joe, you can give some references now.
Yeah, if it's okay, Brendon, I'd also like to add around the idea of asking people what they've enjoyed in the past. I've found that really useful for the people that I've worked with, although mine is more people with severe mental illness rather than older populations. But I think the same things can apply around people feeling unsafe to engage in new forms of activities. And asking people what they've enjoyed in the past, usually over the course of the life course, even if it's just at PE at school or what they did with, their parents when they were children, you can find activities that they'll feel comfortable in because they remember doing those before. So that's a good way to start. And if not, then also now we're learning more in older populations specifically. We're learning more and more about the benefits of resistance training for people who don't want to go out running or don't feel comfortable taking up sports. The gym environment can be really safe and obviously supported with a personal trainer to engage in some quite low impact resistance, and you get real benefits from that. We're seeing more and more evidence for mental health, brain health, and then also physical health, and actually preventing frailty and preventing falls. Resistance training is like the new key, really. So that's what I'd recommend.
And based on your all's expertise and knowledge of the data, what would be some recommendations, if any, around the amount of strength exercise, aerobic exercise, and just general exercise as it comes to promoting optimal mental health?
With the World Health Organization guidelines, we've settled on 150 minutes per week of moderate to vigorous activity, and that can include your resistance exercise for adults. So that usually involves, however much pure aerobic training, and then we recommend around 3 days per week of strength training exercises. But that doesn't need to be hitting the gym. It can be involving yourself in other forms of physical activity that involve, quite strenuous muscular movements. So that's kind of the broad recommendations. And I would add actually what people kind of forget with the global physical activity guidelines is that is just for adults. For people under 18, it's much higher what we're recommending. It's around 60 minutes per day, times over the week, a lot more than 150 minutes. So sometimes that message gets conveyed to younger people, and especially during lockdown, we're probably missing the potential detrimental impacts that physical inactivity could be having on young people, because they're going to be falling so below the recommended guidelines for their age group at the moment. That's quite a worrying thought. So, but yeah, they're just the broad recommendations from the World Health Organization.
Thank you for giving us the inside scoop there on the updated guidelines. Simon, I see you're unmuted. Is there anything you wanted to add?
Yeah, I just wanted to, it's not specific on that point. I've just been looking at the chat and some of the questions, and one of the questions around like, what can we do? What's the one thing, system level changes? And I think the one thing that I would stress is, as health professionals, it kind of relates to what's happening around the current protests, but actually we know that health professionals who are active themselves are far more likely to A, recommend that to the patients they're working with, and B, for that advice to be successful. So I think one of the best things that we could do is actually start with health professionals themselves, ensure that medical students are trained in exercise prescription and in physical activity counselling, ensure that psychologists are trained in providing exercise and dietary advice to patients. I think that's probably one of the most important things that we could do immediately to try and actually change the culture around this and actually embed these sort of interventions.
Yeah, so we're getting, thanks Simon. That's definitely a question I think we can end on, which is raised by Dr. Loveday about what are some of the main barriers to change for exercise and mental health promotion really to be implemented for all, and ties in with an earlier question about, are there any special groups at risk of not getting, the recommended amount of exercise in America. So maybe we could end with your last thoughts on kind of that issue, how we can make physical activity for mental health more accessible to all. What are some of the changes that you'd like to see? And then we'll pass it over to Karestan to wrap up.
I'm happy to go first. So for me personally speaking, on my sort of personal and professional and clinical research interests, it's often the people with quote unquote severe mental illness, with schizophrenia, who tend to get left behind. We've looked at how sedentary this population are, how isolated this population are, and there's huge social, ethnic and other disparities amongst this particular population. Often get really left behind, and we see the biggest mortality gap in this population. But there are interventions which are effective, so I'd like to see adequate funding provided to reach out those with severe mental illness, because interventions can help to improve really important outcomes, which are leading to like a real scandal of premature mortality in this particular population. So that would be my number one recommendation: adequate funding for those with severe mental illness.
I'll be very quick and then hand over to Joe. I would just say that we need to completely integrate these interventions, so exercise and diet, as part of routine care, not an optional added extra that would be nice if we get around to it. If we have the funding, there should be exercise and diet practitioners embedded within the mental health team.
Yeah, I'm actually going to build on what Simon said there. He really hit the nail on the head with the end statement, which is around, involving exercise and physical health professionals in mental health care. We do currently kind of pressure and rely too much on mental health staff to be doing all the physical health stuff as well, which is sensible to a degree if in a world of limited funding. But if we want to see these interventions actually making a difference, you need to involve those expert professionals. You know, we wouldn't have the physical activity people expected to deliver the mental health interventions, and I'm not sure why we expect it the other way around. So
Sure.
it's about involving those staff really to start seeing a difference.
Awesome. Thanks, everyone, especially to Brendon, Simon, Joe for a fantastic session. So before we close, I'll have Karestan.
Yeah, thank you, Karmel, Simon, Brendon, and Joe. This was terrific. I learned a tremendous amount. So, and I also was thinking back to my clinical training when we never talked about the relationship between exercise, actually physical health and mental health at all, or exercise and mental health. So this was really great. And this will be available on the website if people want to share it or come back to it. And thanks everyone for joining us. Our next sessions are on our next mental health forums are on June 17th, 11 a.m. We'll have one on domestic violence and in the COVID-19 pandemic. And in the afternoon at 2 p.m., we'll have one on racism and mental health. So thank you everyone, and be well. And thank you again for our panelists. I appreciate it, especially getting up at 1 a.m. to do this. Terrific. Take care.